It's something most of us take for granted until it becomes difficult. Today, we're talking about a serious condition that affects many people, but often goes unnoticed until it's too late. Interstitial lung disease, or ILD. In this video, we'll break down the symptoms, causes, and most importantly, how you can prevent or manage this life-altering disease. Whether you're affected by ILD or want to protect your lung health, stay tuned to learn valuable tips. What is interstitial lung disease? Interstitial lung disease refers to a group of conditions that cause scarring and inflammation in the tissues surrounding the air sacs in your lungs. This scarring makes it difficult for oxygen to pass through the lungs into your bloodstream, making breathing hard. Imagine trying to breathe through a straw that keeps getting smaller. That's what people with ILD experience. Over time, it becomes harder to get enough oxygen, and everyday activities like walking or climbing stairs can feel exhausting. This condition is more common than you might think. ILD affects millions of people around the world, but it often goes undiagnosed until it's in an advanced stage. Common symptoms of ILD. Symptoms of ILD can vary from person to person, but the most common signs include 1. Shortness of breath, especially during physical activity. At first, you may notice that activities like climbing stairs, walking long distances, or even light exercise become more challenging. You might find yourself getting winded much faster than usual. Over time, this shortness of breath can worsen, even making simple daily tasks like getting dressed or cooking feel exhausting. The reduced oxygen flow in the lungs forces the body to work harder, leading to a sense of breathlessness that can disrupt daily life. 2. Dry, persistent cough. One of the hallmark symptoms of ILD is a dry cough that doesn't seem to go away. Unlike a typical cough from a cold, this one isn't accompanied by mucus or phlegm. It's a nagging, non-productive cough that may worsen over time and can become particularly disruptive. It might interrupt your sleep, making you feel more fatigued throughout the day, or cause discomfort in social situations. 3. Fatigue. Feeling constantly tired, even after a full night's rest, is another common symptom. Fatigue in ILD patients often stems from the body's struggle to get enough oxygen. Since the lungs aren't working as efficiently, the heart and muscles need to put in extra effort, leaving you feeling drained. This level of exhaustion can make it hard to keep up with your usual routine, affecting both work and personal life. 4. Unexplained weight loss. Many people with ILD experience weight loss without trying. This might happen because the body is using more energy to breathe, or because the disease affects the ability to eat and absorb nutrients properly. As breathing becomes more difficult, some individuals may also lose their appetite or find eating tiring. If you're losing weight without making changes to your diet or exercise, it's important to bring this up with your doctor. 5. Chest discomfort. Some people with ILD report feeling tightness or discomfort in their chest. This isn't typically the sharp pain associated with heart problems, but more of a feeling of pressure or heaviness, which can make breathing feel labored. This sensation may increase with physical activity or when you're lying down, contributing to feelings of anxiety or restlessness. Do any of these sound familiar? These symptoms may seem mild at first, but they can gradually worsen as the lung damage progresses. It's important to remember that these signs are often subtle and can be easily mistaken for other conditions, such as asthma or general aging. That's why many people delay seeking medical attention, allowing the disease to progress undetected. If you or someone you know is experiencing any of these signs, don't ignore them. Why early detection matters. Early diagnosis of ILD is crucial because the scarring of the lungs can't be reversed. The sooner it's identified, the better your chances of slowing the progression of the disease. With prompt medical care, lifestyle changes, and possibly medications, many people with ILD can manage their symptoms and maintain a good quality of life. When to seek medical attention? If any of these symptoms resonate with you, especially if they persist or worsen over time, it's essential to schedule a visit with a healthcare provider. Diagnostic tests, such as lung function tests, imaging scans, or even a biopsy, may be required to get a clearer understanding of what's happening in your lungs. So what causes this condition? There isn't always one clear answer. ILD can be triggered by several factors. 1. Exposure to harmful substances like asbestos, silica dust, or mold. Many people develop ILD as a result of long-term exposure to hazardous materials, often in their work environments. Industries like mining, construction, and agriculture are high risk due to frequent contact with dust, chemicals, and other airborne toxins. Asbestos, once commonly used in construction, is a well-known culprit, along with silica dust and mold spores. When these particles are inhaled, they can irritate and scar the delicate tissues in your lungs over time. Example: consider workers who spend years cutting stone or handling insulation materials. Without proper protective equipment, these particles can infiltrate the lungs and, over time, lead to chronic lung damage, eventually manifesting as ILD. 2. Autoimmune diseases like rheumatoid arthritis or lupus. Autoimmune conditions, where the body's immune system mistakenly attacks its own tissues, can also trigger ILD. Diseases like rheumatoid arthritis, lupus, and scleroderma are known to cause inflammation, not only in joints and skin but also in the lungs. This inflammation leads to scarring, reducing the lung's ability to transfer oxygen efficiently. Example: someone living with rheumatoid arthritis may experience joint pain and stiffness, but may also develop respiratory issues due to the underlying inflammation affecting lung tissues. If left unmanaged, this can evolve into ILD, complicating their overall health. 3. Certain medications or radiation therapy. Certain medications, particularly those used to treat cancer or heart conditions, can have side effects that affect the lungs. Chemotherapy drugs, some heart medications, and even certain antibiotics have been linked to lung damage that could eventually result in ILD. Similarly, radiation therapy used to treat cancers in the chest or neck area may lead to lung scarring, especially if treatment lasts for an extended period. Example: a cancer survivor who received radiation therapy to the chest area may develop symptoms of ILD years later due to the cumulative damage the radiation caused to the lung tissue. This delayed onset is one of the reasons why it's crucial to monitor lung health long after treatment has ended. 4. Genetic predisposition. Genetics may also play a role in developing ILD. While rare, some people are more genetically predisposed to lung diseases, including ILD. Research has shown that in certain families, individuals may inherit genes that increase their susceptibility to lung scarring or autoimmune conditions that affect the lungs. These genetic factors may interact with environmental or occupational exposures, further increasing the risk. Example: in some families, multiple members may develop ILD without having clear exposure to known risk factors. This suggests that genetics can influence how the body responds to even mild environmental triggers, leading to the progression of the disease. 5. Smoking. Smoking is a well-known risk factor for many lung diseases, and ILD is no exception. While smoking may not directly cause all forms of ILD, it significantly increases the risk and can worsen the condition in individuals who are already susceptible. Smoking introduces a variety of harmful chemicals into the lungs, causing inflammation and long-term damage. Even people who have quit smoking may still be at risk due to the lingering effects of previous exposure. Example: a long-term smoker may experience persistent coughing and shortness of breath. Even after quitting, these symptoms could persist or worsen over time, leading to the diagnosis of ILD. Environmental and occupational factors. Environmental and occupational factors play a big role. For example, those who work in mining or construction may be exposed to harmful particles that, over time, can damage the lungs. Example: let's take someone who works in coal mining or construction. Day in and day out, they are exposed to dust, silica, and potentially harmful fumes. Without proper respiratory protection, these tiny particles settle deep in the lungs, where they can create irreversible damage over years of exposure. Even with modern safety protocols, prolonged exposure can still pose a significant risk. It's not just those in high-risk jobs. People living in highly polluted cities or near factories may also be exposed to harmful air quality, contributing to the development of ILD over time. Idiopathic ILD, when there's no clear cause. However, not everyone who develops ILD has been exposed to these risks. Sometimes ILD occurs for no clear reason, which is called idiopathic ILD, the most common type being idiopathic pulmonary fibrosis. For many people with ILD, there's no obvious explanation. This is known as idiopathic interstitial lung disease, meaning the cause is unknown. The most common form of idiopathic ILD is idiopathic pulmonary fibrosis, IPF. In IPF, the lung tissue becomes progressively scarred without any identifiable cause. Unfortunately, this form of ILD tends to be more aggressive and can worsen rapidly, leading to significant breathing difficulties. Example: a person with idiopathic pulmonary fibrosis may have lived a healthy lifestyle, avoiding smoking and other known risk factors, but still experiences shortness of breath and fatigue. Despite numerous tests, doctors may not be able to pinpoint a specific cause for the scarring in their lungs, leaving the condition classified as idiopathic. Takeaway: the reality is that ILD can be triggered by a variety of factors, some known and some still not fully understood. Whether it's due to environmental exposure, an underlying medical condition, or a genetic predisposition, the effects of ILD can be life-changing. Recognizing the causes, however, is a critical step in prevention and early detection. Now, let's talk about the most important part. What can you do to prevent ILD or manage it if you've been diagnosed? 1. Avoid harmful substances. If you work in a high-risk industry, always use protective equipment like masks and ventilation systems. Avoid secondhand smoke and polluted environments. Protecting your lungs from dangerous substances is key. If you work in areas where dust, chemicals, or fumes are present, wear the appropriate protective gear and make sure your workspace has good ventilation. 2. Quit smoking. Smoking severely increases your risk of developing lung diseases, including ILD. Smoking is one of the leading causes of lung disease. If you smoke, quitting now can greatly improve your lung health and reduce your risk of ILD. 3. Stay physically active. Exercise regularly to keep your lungs and heart strong. Activities like walking or swimming are great for improving lung capacity. Staying active helps keep your lungs strong. Even simple activities like walking or swimming can improve your lung function and overall health. 4. Follow your treatment plan. If you have ILD, work closely with your healthcare provider to manage your condition. For those diagnosed with ILD, managing the condition is critical. This could include medication, oxygen therapy, or pulmonary rehabilitation. Always follow your healthcare provider's advice and stay on top of your treatment plan. 5. Regular checkups. Early detection can make a huge difference in how ILD progresses. Regular health checkups are important, especially if you're at risk. Early detection of ILD can slow its progression and improve your quality of life. Interstitial lung disease is a serious condition, but with the right knowledge and care, you can manage it and improve your quality of life. Prevention is always better than cure. So take care of your lungs today to avoid issues down the road. Remember, your lungs are vital to your well-being. Whether you're trying to prevent ILD or manage the condition, small changes can make a big impact. Stay active, stay informed, and protect your health. Thank you for watching. If you found this video helpful, make sure to like, share, and subscribe for more health tips. Leave any questions you have in the comments, and we'll be sure to address them.